Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
We sometimes have patients in whom we start durvalumab and they develop pneumonitis. It could be because of the durvalumab. It could be because they were destined to get it anyway, and it's just coincident. Our standard treatment for pneumonitis is time and steroids and oxygen as needed. And typically, if it's more severe, we would also stop durvalumab. If you have a patient who recovers after tapering steroids after 2 months, and say they were 3 months into their treatment at that point, are you inclined to resume the durvalumab, or do you just leave it at that point?
I think that's a good question. I think it depends on how bad that pneumonitis was, and if it landed the patient in the ICU, probably not.
Okay.
If it was a little bit of a milder case where they got started on steroids, improved rapidly, you were able to taper them off within a month, it's a conversation. I do worry a lot about the pneumonitis and the potential for retreating and then having another episode of pneumonitis, in which case you may not necessarily be as lucky, where they respond right away to steroids. And so I tend to, I think, not pursue it as aggressively. That once the patient's developed pneumonitis, if a patient's really gung-ho and wants it, again, it's kind of that shared decision making, but it makes me a little bit nervous. And I think that the studies have shown that patients who develop it, on durvalumab, and if you re-challenge, that they're at a somewhat higher risk of having it again. And so that piece of it, I think, is what makes me nervous about restarting or re-challenging.
Matt, your thoughts?
Completely agree. If I have to give any steroid at all for a pneumonitis, I'm not going to continue the durvalumab, the infancy. And it's a different calculus than if a patient has stage 4 disease. Again, in stage 3, maybe we've cured them with chemo radiation and the durvalumab was superfluous. But because there's a little different risk-benefit package there than there is in stage 4, where maybe I don't have that many other options beyond this, then I might re-challenge after discussion of, hey, your chance of having another bad pneumonitis is probably half-half. I mean, that's at least what some of the data are showing us.
Yeah,
whereas in the stage 3 setting,
4.
I'm going to say, the other thing that I would point out is that in all these immunotherapy discussions, none of us know what the right duration of therapy is to accomplish what we want to accomplish.
Right.
And we've all probably had patients where I've had patients get one dose of an immunotherapy, have a terrible side effect. I don't give them any more, but they have disease control for years. But other patients were after 2 years, then they recur as soon as I stop. So a year is already a little bit artificial because we have to have rules. But
it's a circle around the sun. So
Exactly.
There you go. That's how it must be biologically. So I think that point's very well taken. That we do have limited data from the study that you could stop and then resume safely. The patients who stopped after a shorter period seem to get very comparable benefit to the patients who didn't. And in various immunotherapy trials and settings, largely looking retrospectively, the patients who had more significant side effects do seem to get at least as much benefit, if not more, perhaps because that is a representation of a very active immune function. But much more to learn about this. And I agree. If you had somebody who improved dramatically and stopped, was able to taper steroids after the first month of durvalumab, it's one thing versus getting through 10 months and deciding at that point. But it adds up, and I think that that's something we need to learn more about.
you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly, Novartis, Takeda, AstraZeneca, and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate and visit us for more information at cancergrace.org. Thank you for listening.